Think back to a time when you felt misunderstood or on edge, maybe even reacting in ways that surprised you. Now, imagine feeling that way every day. That's often what life is like for individuals with trauma histories. So, how can we take trauma into account when designing interventions and ensuring that we're not just shaping behavior, but doing it with sensitivity and empathy and long term healing in mind? How do we create trauma sensitive behavior interventions?
Hi, I'm Shira.
And I'm Shayna.
We are behavior analysts who create weekly content about how to teach kids with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about trauma sensitive behavior interventions. And if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
I recently heard an analogy about trauma. And it's really about a stone hitter, or a stone cutter. So think about this. If you have a hammer or a mallet and you're chipping away at a stone and you hit the stone 10 times, nothing happens. And then you hit the stone another 10 times and nothing happens. But then, the 100th time or 101st time, finally the stone breaks in half. And that can be an analogy about trauma as well, because when we think about trauma, we think about big T trauma, which are the big events, but sometimes some of those little hits are the ones that hurt the most. So sometimes just those little T traumas that we talk about can be the ones that finally break us in half.
Yes, it's so important that we acknowledge that it's the little bits of continuous exposure to negative events that really affects an overall, functioning and well-being of an individual. Um, in planning for this podcast, referencing an article in 2021 by Raja Raman, I hope I'm saying that right, and colleagues who really discuss a framework for incorporating what we call trauma-informed care into ABA. And there are really like four things that they're suggesting. One is to acknowledge the trauma. The other one is to ensure safety and trust, to promote choice, and emphasize skill building. The other thing I think is important to discuss is we talk about trauma-informed care, which is very different to a trauma-specific service. So as behavior analysts, we may not be providing, a trauma service. We may not be, working with an individual on getting over a trauma. That's not what we're referring to. Trauma-informed care is not a specific intervention, but it's an approach. It's a more universal approach that we take on an organizational level in terms of how we write behavior plans, how we look at skill building, how we manage behavior, how we look at reinforcement and choice in a sense, and all of these things from a more big picture perspective in assuming that there could have been trauma.
And when we think about trauma, we talk about this catchphrase of trauma informed care. And then, we go, okay, well, this person hasn't had trauma. So, let's not think about that. But Hanley talks about not saying trauma informed, but actually trauma assumed. And that comes down to those little T traumas that everybody probably has some little T's, for lack of a better word, that have happened to them. And we need to, as we're discussing a behavior plan, this should always be brought up. Like, is there anything that we need to consider at all when developing this plan?
And again, we're not looking to assess a certain trauma. We're not looking to dig deeper into anyone's past. It doesn't have to be anything like that. But the first step that they're suggesting in their framework is acknowledge. Acknowledge that trauma isn't just about a single event. It's about a series of responses that really linger after an event has passed, and that really affects how an individual is really looking at the world around them and assuming that something that I'm doing could re-traumatize that. So being very careful in the things that we're choosing, in knowing that that could really re-trigger something. The next thing that we talk about is once we can acknowledge that there is a trauma-informed, trauma-assumed care approach, we want to have environments that ensure safety and trust. We want to really focus on building rapport with clients. We don't want to resort to things that involve restraint, anything intrusive, overly prompting. We want to focus on creating an environment that really, really feels safe and clients' needs are being met. The person working with the client is responsive and is respectful.
Let's talk about a few examples here. Before this podcast, you and I were brainstorming. Okay, well, what are some examples? What do we have as stories? For instance, one individual I work with who can engage in aggression. When he was younger, he was in school and he was drawing comic books. He was doodling and he wasn't paying attention to the teacher. And the helper in the classroom came along and took the comic book from him. And keep in mind, comic books for him were his pride and joy. He used to create them, and it was just, he loved it. But she not only threw it in the garbage, but she ripped it up before she threw it in the garbage. And he was mortified. But to this day, we can't touch his stuff. And it could have been from that event, but it could have been from other things as well. So in his behavior plan specifically, we have in there, don't touch his stuff. We actually have a box that we've said, he can put his stuff in this box, and then we can take the box and put it somewhere. But he is the one who, is the one who releases his things. And that's as simple as it is. Trauma-informed care doesn't have to be a massive document. I mean, it can be, but it doesn't have to be. It can be one small piece like, yep, I recognize this, and this is what we are doing.
And I think it's also the shift from, as behavior analysts, we get really good at outcomes. We get really good at getting to the behaviors that we want to see. And I think the thing we have to get better at is the process of how we got there, because we can, prompt our way through things, or we can use certain strategies to get our clients to show the behaviors that we want them to see. But thinking about, in that process, am I harming this individual? And it doesn't have to be like Shayna's example of the rock. It doesn't have to be actual harm, but are we exposing them to little chips away at their feelings of safety and trust that would end up with long-term repercussions? Similar to the example of this student is promoting, their third framework is promoting autonomy, and this term, which I love, which is shared governance. And that's really about allowing choice, but real choice, not choice of, forced choice or what do you want to work for, reinforcer kind of choices, but real choices that they can feel validated throughout any kind of intervention, and that those are respected.
I think that it's really important to say that any choice is good. So if it has to be forced choice, do you want this or this? It's choice. If we have, okay, well, what order do you want to do these particular things in? That's choice. But just looking throughout the day and saying, okay, how can we put more choice in? And instead of, laying out a student's clothes, can the student pick what clothes they want to wear? It can be a lot of different things. But, I think what Shira is saying is that, forced choice is still valuable, but make sure you're extending it beyond that choice.
And like the example of, him having a box for himself, they should have things that belong to them, and we should allow them that autonomy over their own things and their ability to have a voice and be able to work together with our students. One of the things that I like using when relevant is something called enhanced choice model, which is in line with this. And it really involves couple different options for the student to really choose. So instead of there being, here's your ability to access reinforcement, and here is the inability to access reinforcement, there are a couple different options. And enhanced choice model is they get to opt in to, earning reinforcement. And it's not because the other option is so not really a choice. It's because there are other options, and I'm choosing to do the work. I'm choosing to be uncomfortable, do the thing that's hard, because it'll bring me closer to my values. And then the fourth part to remember is, as behavior analysts, and this is in our code of ethics, is that we choose skill building and positive behavior strategy techniques before any kind of punishment or, those kind of techniques. And our focus, this really comes back to a trauma-informed care, is our focus is on teaching them the skills that they don't have. And when we can focus on skill building, a lot of the challenging behaviors will, automatically decrease. But it's also on not triggering our students anymore, teaching them skills when they're calm, giving them opportunities to be calm and then learn those skills slowly and effectively.
So being able to adapt these behavior interventions to a more trauma sensitive approach does require some flexibility. And as behavior analysts, sometimes we're not flexible. So making sure that we can incorporate mindfulness into our practice and really ask ourselves, are we seeing the whole picture? And are we being empathetic to our learner, not just, sensitive to their needs, but really understanding, what their needs are, and then having that flexibility to adapt to that. So, some tips would be just making sure that you take some time to build trust. We talk about pairing. Pairing can happen even with older individuals, and it can also happen with individuals who we may already have a little bit of a relationship with, but make sure that you're continuing to build that relationship and establish that trust. We talk about following through, but it's not about following through with a demand, but it's following through with the good things too. So it's about following through with things you've promised. Hey, next time I come, I'm going to bring blah, 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 blah. Make sure you bring that, whatever you promised. If you say, oh, you've earned this, make sure you follow through with that and make sure that they do. Another huge thing is teaching self-advocacy skills. And this to me is massive. This is a program that I always, always, always have in an ABA program, regardless of how verbal an individual is. They should always be able to self-advocate. And it may just be at the beginning, like a simple no, thank you, or I don't like it. But as they get, more verbal and, more complex with their understanding, they can start advocating for themselves. Like, no, you know what? I need more time on tests, or no, I really want to be sitting here and not here, or this light isn't so great, or this sound really hurts my ears, and those kinds of things. So making sure self-advocacy skills is at the top of any type of behavior intervention plan. And also making sure that you're continuously reflecting on what's working and what isn't. And as behavior analysts, we're collecting data. So making sure that you're not just collecting data for the sake of collecting data, but actually analyzing that behavior, and then having talks with your entire team of, hey, what's working and what's not, and incorporating the learner as well if you can. What do you like about this? What don't you like about this? Okay, you don't want me to touch your stuff? No problem. Let's get that box. Or, oh, you don't want me to do this? No problem. Okay, how can we choose that? And then that way you can incorporate choice as well.
And the freebie that we have available is what a universal protocol template. And the reason for that is because when we can train our staff to all come and approach challenging behavior, or our students, with a similar, trauma-informed lens, then they're on a day-to-day basis working with our students differently. It's not just how we respond to challenging behavior, but it's how we follow through, it's how we prompt, it's how we teach. And so we've created a universal protocol cheat sheet that we are giving away with this episode.
We also have another podcast episode 129 on compassionately targeting challenging behavior. So check that out as well.
For more information on trauma-sensitive behavior interventions, click the link on or around this video or in the description to claim your free Applying Universal Protocols cheat sheet. We also encourage you to subscribe to the channel so you don't miss any future videos, and leave a like and comment below if you have further questions.